testing for the virus and tracing how it spreads is critical to containing it locally so that we can ease the national lockdown. And it's by isolating the virus that we can control it and we can stop it spreading through our communities. In this plan to lift lockdown, test and trace is our radar, if you like. It helps us identify where the virus is and trace how it's spreading through the community. And you have your part to play. If you have symptoms, you must immediately self-isolate and get a test. It's easy to get a test on nhs.uk or by dialing 119. If you test positive, you must work with NHS Test and Trace to identify who you've been in close contact with. And if you're asked by NHS Test and Trace to isolate, you must do so to break the chain of transmission and to stop the spread of the virus. I'm also delighted to say that we still have spare capacity, and long may it remain so. This is a good thing. It's a sign of the team's success. And I just want to take this moment before I hand over, very formally, on behalf of us all, to thank Dido and her team, to thank the army of contact tracers, thank you, to thank the NHS and Public Health England, who are playing such an important role, to thank the private companies without whom this would be impossible, including Boots and Amazon and Serco and CETAL. And finally, I want to thank you for your participation. It is brilliant that the vast majority of people have done their civic duty. And as we work through our plan, and as we keep driving this virus down, let us maintain that spirit and fortitude that has helped us throughout this pandemic. So the answer, I'll ask Dido to come in with the details, but the big picture answer, Laura, is yes, there are some people who don't have symptoms but do have the virus. And in fact, in the ONS study, we find that around 70 to 80% of people who test positive don't have symptoms. So that is quite a significant finding, and one of the important things about this disease, in the same way that asymptomatic transmission is one of the things that makes controlling this disease really hard and is novel for any coronavirus, and is part of this, one of the things that makes it so difficult.